Hey, what's up, everyone? It's Dr. Glenn Vo. I am here at the Dental Festival in the Accept Care Lounge. We've been talking about Accept Care a lot, and we're going to have a video that's going to be sent out pretty soon that'll explain all about it. That's something you don't want to miss. But right now, I have a guest right here. It's Renata with Airway Circle. Hello, how are you doing today?
I'm doing great. Thank you for having me.
So I'm super excited because, we just got connected here, and the mission of the Airway Circle is so important. It's something that encompasses like everyone on the team, from the doctors, hygienists, all your team members. And it's really focused on making the lives of your patients better. So I'm going to give you the privilege of explaining Airway Circle because I probably won't be able to explain it very well. Tell us about Airway Circle. What is the Airway Circle, and what is the purpose of the Airway Circle?
All right, great. Well, Airway Circle is an online study club for professionals who are interested in learning more about airway, breathing, sleep, and myofunctional disorders. So we host weekly webinars with educators from all over the world to bring to you the latest research, different treatment approaches, and resources that are going to help us all become better clinicians.
So we understand how important airway is, right? With sleep. I mean, obviously there's a lot of companies here that are training people how to take care of a patient with sleep apnea, but airway is so much bigger than sleep. But before we kind of go down that rabbit hole, let me ask you this. Tell our audience your training, your experience, and honestly, why you're so excited about this.
So I've been a dental hygienist since 2010, and about 6-7 years ago, I fell into the rabbit hole of myofunctional therapy when I took a course at the Hinman with the wonderful Dr. Tom Colquitt, who's been doing this forever. And immediately when I realized as a dental hygienist that there was something more that I could do for my patients, I just couldn't drop the books. I started immediately learning everything I could about myofunctional disorders, and airway and sleep. It's all intertwined.
Yeah.
And it's so important. I feel like as a hygienist, whenever I look back, I have missed so many patients. And that is why I feel like I'm so passionate about this, because if I can teach other dental hygienists to see what I missed, they're also going to be able to help so many more patients find optimal health.
So can I ask you this question? When you took your first myofunctional therapy course, did you start seeing things that you didn't see before, and now that you see it, you can't unsee them, right? Is it one of those type of things?
Exactly. So you only see what you know.
Yeah.
And that is the issue with Airway Circle, with all of the lectures that we have. I mean, some of the things that we have on there, it's mind-blowing. Just this week, we had a talk with 2 speech pathologists from Brazil. One of them, who is known all over the world, she actually helped pass a law in Brazil that every single baby born needs to be checked for oral ties.
Wow.
And we were talking about classification of oral ties. Why do they not have a way to classify them? And she said that for many years they tried to find all these different ways to classify. And whenever they thought they found the perfect protocol, a new patient would come in that would not fit exactly what they had down. So every frenum, they were saying, it's very unique to every individual. But the embryology and histology of a restricted frenum is actually present at 4 to 8 weeks gestation.
Wow.
So it's already that early. But it's things like this that we talk about that we need to learn from each other, from other professionals. If we don't talk, we're not going to know what somebody else is looking at. All of us have very unique ways of looking at patients. And I need to know what a physical therapist is looking at. I need to know what an occupational therapist is looking at, so I can properly refer my patients.
Well, again, you just said it, right? You only know what you know, right? And so, again, I want to kind of explain that a little bit further. With when we talk about airway, everyone naturally thinks like, okay, it's like a sleep apnea, right? Like get an appliance there and whatnot. But when we talk about airway, everyone naturally thinks like, okay, it's like a sleep apnea, right? Like get an appliance there and whatnot. But when we talk about airway, everyone naturally thinks like, okay, it's like a sleep apnea, right? Like get an appliance there and whatnot. But airway is so much more than that. So can you just kind of like educate our audience here? Like, okay, they're thinking airway, okay, sleep. But it's more than that. What else does Airway Circle encompass, or airway in general encompass beyond sleep?
So it's all about, it starts a craniofacial development. We need to, be 3-year-olds and keep lifting our hands up and just start asking why. Because until this point, all we're doing is just fixing symptoms. If somebody has malocclusion, well, what caused somebody to have malocclusion? So we study heavily craniofacial development. When does it start? What is the role of a mom being pregnant into the fetus developing? How about after the baby's born, breastfeeding? What is the role of breastfeeding when it comes to craniofacial development? We talk about nutrition all the time, but it's not only that. So in order for your face to grow, the muscles need to be working properly. The more you exercise the muscles, the stronger the bone is going to get and the more it's going to grow. So we talk a lot about tongue position. Where should your tongue be? The tongue suction to the roof of the mouth all the way up should be up there day and night. That's going to help protect your airway. Yeah. And you guys can try it at home. If you suction your tongue all the way up to the roof of the mouth, try to take a deep breath through your mouth. You simply can't. So that's going to promote nasal breathing. That's going to protect your airway, preventing your tongue from falling in the back of your throat and obstructing your airway whenever you're asleep. There is so much involved in airway.
That's why you created this resource, because it's not, when you took that course years ago at the Hinman, and we've had other hygienists that they took that, but really what you're saying is that's just like the beginning.
It's the beginning.
Like people, a lot of times they're thinking like, okay, well, I did that course. Yeah, you just started. It's like you just graduated and you just got a degree, but there's so much more training there. Oh. And again, that's the reason why you started Airway Circle. Exactly. and having like a community. It's like a community, right, where you guys work together. It
actually has become a very tight-knit community. I keep saying that it's a safe place for us all to connect, share, and collaborate.
And ask questions.
And people feel very comfortable asking questions, and we have the top leaders in the industry. They're in our group and they are helping, answering these questions. Because if you think about it, whenever you learn something, if you don't share with anybody, because a lot of people are like, oh my goodness, I paid so much money for this knowledge, or I learned this, I'm not going to give it to anybody. It dies with you.
Yeah, true.
But if you help somebody else that's starting, by sharing some information, they are going to be able to help more patients. So you're impacting so many more lives. So yes, we have this multidisciplinary group and we are learning from everybody, things that we never thought before. For example, both of my children crawled with one knee only. We thought it was the cutest thing. It was funny. But guess what? That's a problem with a gross motor development. By talking to all these occupational therapists and physical therapists, now I'm learning all of this. That whenever you do not develop your gross motor skills very well, it's going to impact your fine motor skills. So it could affect your language.
Wow.
And there's so much more, grasping little things with your fingers. So it is so important for us all to communicate and collaborate.
So, we have all sorts of dental professionals that watch this podcast, a lot of dentists too. And so some of the dentists are watching this right now. They're thinking, okay, I see that, and I'd like to have my hygienist and maybe my team members join Airway Circle. How does that work exactly? Is it a membership? Is it like just a site that they go to and get resources? Tell us how that works to kind of get into the Airway Circle community.
So we did create a membership with Airway Circle, but we have a huge focus on giving. So because we want to raise awareness for all these issues, we do have a podcast that is free with information. We do have a YouTube channel that is free. Every single one of our Thursday webinars are free if you watch them live. So if you'd like to access our pool of webinars, past webinars, it's $35 a month. And it's literally just to help us keep bringing these amazing educators to you, so we can all learn and grow together.
Basically, that's like a Starbucks a week. Really, it's just a Starbucks a week. But the thing is that not only will your team be more confident, right? is also going to help grow your practice. So I want to switch gears a little bit because, a lot of times practice owners are thinking, okay, well, how am I making money off of it, right?
Yes,
They always like to
definitely.
ask that. So, look, you've been doing this for a while. Explain to everyone, like, if your hygienist can do understands
Yes.
myofunctional therapy, be able to identify patients that need therapy, need treatment. Obviously, you're helping the patients, right? But a lot of times when you help patients, you're actually helping improve as far as like production and whatnot. So explain to everyone, like, how does that relate there as far as like being able to grow the practice?
So let's start thinking about the patients that come through your door. How many patients do you get that have chipped veneers or crowns after you have put them on there? And it keeps happening over and over. So we need to ask the question, why is that happening? How about for other orthodontists out there, those patients that the teeth keep moving back, they relapse. Why are they relapsing? There are so many patients that are coming through your door, TMJ patients. 80% of TMJ patients have myofunctional disorder. So if we're not focusing on the muscle, so just for the fact that you have a myofunctional therapist in your practice, you are going to get a lot of patients. There's a couple different ways that you can have a myofunctional therapist in your practice. So I usually recommend a dental hygienist, if they still want to do hygiene, to do it on different days. You clock in as a hygienist one day, you help screen patients. Every patient coming through the door, we're screening. There's a really easy airway screening called the Ferris 6. It takes seconds for a dental professional to check a patient to make sure they could have high risk of sleep disorder breathing. And then a different day they would come in as a myofunctional therapist and treat those patients only. But they're gonna get so busy so fast. It's just a no-brainer. It's the future. It's not going anywhere. I remember when I first started, my dentist said, oh, just like implants, 20 years ago when it kind of exploded. And I'm like, this is not going anywhere.
Yeah.
We need to start looking at the muscle.
Yeah. I mean, that's like great points there. And I will say this is that I'm really big, for those who are watching, I'm really big on elevating the team, having a good team culture. And I'll tell you, a big part of having a good team culture is giving your team the ability to level up their skills and to get better.
Yes.
Right? I mean, obviously there's a lot of amazing hygienists out there, but I want to tell you this right now because I know I'm friends with a lot of them, is that not every hygienist is just going to want to do the same thing over.
Exactly.
They want to get better. They want to do more.
They want to grow.
They want to do more. And what better way to recruit high-level hygienists, high-level team members by saying, hey, we're actually investing in this. I actually want you to understand myofunctional therapy, not only understand it, but I also want you to be mentored by everyone in Airway Circle. So again, I want to just add that because I think that's the best way. So for those who are watching and they're interested, they're like, okay, let me look at the content and let me see, and then maybe possible to join the community. Again, you said YouTube channel. You have a YouTube. So on YouTube, is it just called Airway
Circle?
Airway Circle. And then the website, what is the web address so that they can go and check it out?
It is airwaycircle.com. We actually have a free directory of professionals. That's what really started Airway Circle. It is so difficult, not only as a professional, but as a patient, to find the correct professional that's actually going to be looking at the root cause and help you with the issues that you're having. There are so many offices out there that say that they're airway focused, but they don't start treating children, with, for example, orthodontic care until they're 12. Yeah. That is not very airway focused. We need to start preventively, as early as you can. A baby, as soon as they are born, if they have a neural tie, they're already born with dysfunction. And then a child who's not eating very well. And then anybody who doesn't have enough room for their teeth. There's tongue thrusts. How many of us in the dental field are struggling with certain treatments? That's what I was saying a little bit earlier. By looking at, addressing the muscle, you're going to get less issues. Those patients with TMJ that keep coming back, we need to find out exactly how can we address the muscle so they stay in balance, and like that they don't have as many, a lot of the symptoms will go away. How many hygienists out there have patients that fall asleep on their chair, and we all think we're great hygienists by doing that, and it's not. That's a sleep issue. So we do need to be addressing those. And if you guys would like to check it out, yes, the YouTube and our podcast is called Airway Circle Radio. It's a little bit different. I wanted to have it like a radio station, so we actually have different shows with different hosts.
Nice.
And every one of them is geared a little bit towards a different audience. So we have Dear Mama by Dr. Catherine Murphy. She's an orthodontist who wrote a book called Dear Mama, and it's all about breastfeeding struggles. So whenever she speaks on her podcast, it's mostly toward moms. And then we have Airway Answers, Expanding Your Breadth of Knowledge, with Nicole Goldfarb, who is a fantastic speech pathologist in San Diego and myofunctional therapist. And she interviews some of the biggest names in the field. So a little bit more towards professionals. And then we have Dr. Martha Cortez and Dr. Jennifer Hobson, who are a physical therapist and dentist duo. Their show is called The Beauty of Breathing. Wow. And so it is very eclectic. We have a little bit of everything for every taste and professional out there. So a lot of content.
A lot of content. Well, the great thing is that you'll have a lot of content to look at, to evaluate, to learn.
Exactly.
To learn
you make your decision.
Before you make any kind of decision. So again, there's really the only thing that the only risk you're going to get is the risk of actually knowing more, right? Which is good. So Renata, thank you so much for jumping on, being a guest here. I'm super excited. Love the mission there. And then for those who are watching, whether you're a dentist or a dental team member, please check out the site, because it's all about getting better and providing better for your practice and your patients. And if you do those things, the production's going to come.
Yep.
So thank you so much for jumping on, and we'll see you guys next time.
Of course. Thank you.